Hey everyone, welcome back to my channel. Today we're gonna explore one of the well-known healthcare system in the world. Yes, I'm talking about National Healthcare System of United Kingdom, also known as NHS. Whether you live in UK or have heard about NHS in the news channels, it is praised as a great example of universal healthcare system where every person gets a medical help no matter how rich or poor they are. But have you ever wondered how it all started? Why the NHS created in the first place? And how it has managed to survive a lot of challenges like wars, shift of governments, and even pandemics like COVID-19. So this isn't a story about laws and policies. It's about the struggle the people face, the sacrifices they made, and how a country came together with one powerful belief that the healthcare should be a basic human right, not a privilege. So before the NHS existed, getting a medical treatment in Britain was very difficult. There wasn't one system for everyone. Instead, the healthcare system was a mix of different services. Some were free, but many had to be paid for, and not everyone could afford that. Doctors usually charged money for their services, and the hospitals were either run by the local councils or supported by the charities. This meant the quality and the cost of healthcare could change depending on where you lived and how much money you had. In 1911, a law called National Insurance Act has passed. It gave some working people the access of the medical facilities through their job contribution. But this system didn't help everyone in the country. Family members and unemployed people were not covered in this policy. So for the poor family, getting sick was more than a health problem. It was a financial disaster. The situation was so worse that some couldn't even pay for these treatments, and many people had to go without seeing a doctor even when they are seriously ill. Because of these reasons, health inequality was everywhere in Britain. Rich people could get a good health care while the poor people suffer in the silence. Diseases like tuberculosis and pneumonia were very common, and many babies and young children don't survive. So the healthcare system was very unfair, and from this viewpoint, something had to be changed. Everything began to change during World War II. Britain was in the crisis, cities were bombed, and both soldiers and civilians were continuously losing their lives. But in the middle of this chaos, something unexpected happens in the healthcare system. For the first time ever, medical services were organized and managed by the government in a centralized way. So the emergency treatment were made available for everyone, free of cost. Even the civilians were treated in the military style hospitals, and because of this reason, people saw that the healthcare system should be shared among people equally, and it didn't have to depend on how much money someone had. This experience of World War II changed the people's perspective about healthcare, and it proved that the centralized healthcare system, it's not a dream at all. It can be possible in a real life. So it was possible and absolutely necessary, especially in time of crisis. And when the war ended, the mood in the country had changed. After years of shared struggle and sacrifices, people don't want to go to the old ways of unfair healthcare system. They wanted a better and fair society where everyone have a right to good healthcare services, and it is not related to their background or their income. And that's when Bevan steps into the picture. He was no stranger to the hardship. He was the son of a Welsh coal miner and had experienced poverty by himself. But he worked hard, entered into politics, and eventually becomes the Minister of Health in post-World War II, serving under the Labour government. Bevan had a bold and revolutionary idea. He wanted to create a national health services that would do three most basic important tasks. First, it would be free for all the people. Second, it would be available for all the people in the country, and third, it would be funded by our tax system so that whole society can contribute towards NHS and everyone in the country can get the benefit. This might sound simple, but back then it was a huge challenge. Many doctors of that time didn't like the idea. Many of them were worried like joining NHS mean losing control over their work or earning less money. The British Medical Association was also against it and even accused Bevan of being a dictator. But Bevan wasn't ready to give up. To win doctors over, he offered compromises, which means better payment and freedom to work their private practices. He later made the statement, "I stuffed their mouth with gold." And finally, after all the struggles, on 5th of July 1948, the National Health Service is officially born. For the first time in United Kingdom, people can go to the doctor without even worrying for their income. And when the NHS launched, it brought the three major parts of healthcare system together that was previously working separately. Now they are working together in a big umbrella term, serving the people equally. The first part was the hospital services. As I mentioned before, previously the hospitals were run by the local council or by the charities. Now with the NHS, the hospitals are controlled by NHS and become a part of single system. The second part was general practitioners, the family doctors which people saw usually. Under the NHS, the GPs were paid by the government while maintaining their independent practices at the side. Third was the community health services. This include maternity care, dental services and school health programs. And do you know who was the first NHS patient? A 13-year-old girl named Sylvia, who was treated for her liver condition in Manchester. And from that day forward, something amazing happened. Every person in the UK, no matter how rich or poor, had a right to healthcare services without paying a bill. After its birth, NHS continues to grow faster. Over the years, more hospitals were built, new medical technologies were introduced, and the demand for faster treatment will keep on increasing. But as more people use the NHS services, because of this, the cost of running all the systems smoothly becomes more expensive. This leads to a growing pressure both financially and politically. And the NHS had to go through many changes. In 1960 and 70s, there were major medical advancements. People now live longer and treatments are getting more complex and costlier. So the system struggles to meet the demands. Then in 1980s, under Prime Minister Margaret Thatcher, the government introduced market-style changes. They introduced something called internal markets, by which they wanted to separate people who are seeking medical care and the people who are providing it. In 1990s, the NHS saw the rise in NHS trust and the system called GP fund holding, where the doctors used to control the budgeting for their patients. In 2000s, under the Labour government, Prime Minister Tony Blair's invest heavily in NHS fund, and they were focusing on reducing the time for the appointment as well as modernizing the services. Hospitals got the new building and new technologies, and they set the strict performance tracker to manage and control the NHS performance. Then in 2012, Health and Social Act was introduced. It gave more control to the general practitioners, but also provided private companies to provide NHS services. In my opinion, it was a controversial move that sparks a lot of debate. Despite all these changes and challenges, the core promise of the NHS stays the same. Healthcare remains the same for all the people in UK, and it is available for everyone. But it was clear that from time to time, NHS shapes and reshapes its structure. In 2020, world drastically changed, so did the NHS. When the COVID-19 pandemic hit UK, the NHS was pushed into its limit. Hospitals quickly filled up with the patients, of which many of them were seriously ill. There wasn't enough bed or even staff to handle a lot of patients at the same time. Doctors, nurses and other staff were working overtime. Many of them were exhausted. Some even fell sick by themselves. There were also a shortage of PPE kits. But even in the middle of the chaos, the NHS didn't give up. It responded with courage, creativity and speed. Huge temporary hospitals were built, also known as night-angle hospitals, and when vaccine become available, NHS deliver millions of vaccines to the people. During those tough times, the NHS becomes more than just a health services. It becomes a symbol of hope and resilience. People all over the UK showed gratitude to NHS with Thursday night clap for the carers, where the people used to stood near the doors or the windows and they usually claps to thank NHS workers. But COVID-19 pandemic also reveals deep long-standing problems the NHS had been already struggling with, like years of understanding, shortage of staff and long waiting lists. Today, as we move forward, NHS stands at crossroads. It faces many serious challenges, but also exciting opportunities to grow and improve. So first, Let's begin with the challenges. The NHS is dealing with a staff crisis. There simply aren't enough doctors, nurses, and other healthcare workers, and at the same time, there is a huge rise in mental health issues, especially among young people. Adding to this, the tight budget and aging population that needs more care. But it's not all that bad. There are also signs of hope and innovation. New technologies like AI are helping doctors to diagnose faster and also managing the appointments. There is also a growing focus on community care, bringing healthcare closer to the people's home instead of relying on a big hospitals. So the future of NHS depends on many factors like smart planning, public support and bold leadership. But one thing is very clear. If the nation continues to believe in NHS and invest in it, this iconic institution can keep saving lives for the generations to come. And that brings us to the end of the journey, the story of the NHS from a dream to the most important part of our daily life. So the NHS is not about the doctors and the hospitals, it represents something bigger. It stands for compassion, equality, and the belief that no one should suffer just because they can't afford the treatment. It reflects the values that a lot of people hold dear, standing together, helping each other, and caring for everyone no matter their background. Share your thoughts with me. What do you think about NHS? Is it still the pride of UK? And what changes are necessary for the future of NHS? Share your thoughts in the comment section. I always enjoy reading them. And most importantly, if you found this video informative, please like, share and subscribe to my channel. It really helps the channel to grow and reach to the wider audience. Once again, I'm Madhur and I'm gonna share a lot of interesting public health research related topics with you. Till next time, stay safe, stay healthy.